what I would like every woman to know about endometrial cancers is that it's actually one of the most common women's cancers that we know in the female genital tract. However, it's also one of the most curable.
I'm a uterine cancer survivor of 17 years. I've had 5 recurrences, and what I want every woman to know is don't ever give up.
Uterine cancer is also known as endometrial cancer by a lot of people, and this cancer is usually a disease of older women, that is, women beyond the age of menopause. Most of the time, the symptoms of this are bleeding, vaginal bleeding that a patient hasn't had in a number of years. The woman who has this needs to get that investigated at all costs. We know that vaginal bleeding after the age of menopause is virtually always associated with some pathology.
If you have bleeding, afterwards.
I had some spotting bleeding. I had some discharges that were clear and burnt orange color and several a day. And then I had some mild pain down in my right side and lower pelvic area.
It's about 5% of women who get uterine cancer are premenopausal, and we do see cases in women in their 20s and 30s. Some of them are associated with rare genetic risks, but those are pretty uncommon. Obesity is the #1 risk factor for developing uterine cancer, and obesity is prevalent in women under the age of 50. So women who don't ovulate regularly, meaning they don't have regular menstrual periods, they go months without a period, then have very heavy periods, or they have more than 1 period per month, those are warning signs, particularly in heavier women, that she might be at risk for developing uterine cancer.
If you're going through that perimenopausal period and you're having strange bleeding, go get checked out. Maybe it's just another period hanging on, maybe it's not. And those are the kind of things that can really save lives.
What I want women to know is that if something doesn't feel right with their bodies for 2 weeks or longer, I want them to make an appointment and go to the doctor and demand that doctor do the testing that they think is needed to figure out what is wrong with their bodies. They owe it to themselves and they owe it to their friends and family.